And we are back, dear viewers, to continue our episode with our guest. With us, we would like to welcome in the studio Dr. Syed Rehman, Senior Specialist Internal Medicine at Farwaniya Hospital. So at the beginning, we would like to welcome you here in Hala, Kuwait.
Thank you very much, Sheba, for inviting me to this meet. It's an honor for me to be available for this Hala February celebrations. At the outset, I want to congratulate His Highness the Emir of Kuwait, Sheikh Sabah Al Ahmed Al Jabr Al Sabah, and the Crown Prince Sheikh Nawaf Al Ahmed Al Sabah, and the government of Kuwait, and all the people of Kuwait and the people who are living here. We are lucky. I am here for more than 30 years, and really I feel this is my second home. Fortunately, I am also representing as a secretary for community services. There is an organization, and it's a branch of Kuwait Medical Association. Yes. It is called Indian Doctors Forum. We have around 600 doctors, and we are going to conduct a health camp for poor people. Yes. In Amgara labor camp, this coming 25th, on 25th.
Oh, it's on the 25th.
So I am organizing, yes. I am responsible for this. We are helping, poor people who cannot come on working days. So they find holidays an opportunity, and our doctors are doing this honorable job that they, in spite of their holiday, they come and help to examine and help these people. So I'm part of this. I'm very happy for this, and I want to, really, it's an honor to be to be in this country, and with a leader who has been honored with international repute. Yes. As a humanitarian leader, we are really fortunate to be in this country.
Yes, and of course, we're lucky to have you here with us, and thank you very much for these amazing words that you actually, just provided us with. Thank you very much. Yes. So, Doctor, we would like to talk, of course, when it comes into diseases and spreading awareness to people, especially that are watching us here in Kuwait, the disease that is called thyroid, and of course, the related diseases that comes within it. Because let's say, when it comes into that, lots of people maybe hear the name of that kind of disease, but they lack the awareness of it. So maybe would like to give them about it.
Surely, thank you so much for this very important topic you have raised in front of me. Thyroid is a very, very common problem facing all over the world. Mm-hmm. It's a small gland we have in our neck. It is, it has two lobes, and it's shaped like a butterfly. Mm-hmm. And the middle portion is called isthmus. This gland is richly supplied with blood from the heart. It goes around 100 ml every minute, the blood circulates. And the importance of this gland is all our body, metabolic activities, what we move, our muscles movement, yes. Growth, protein, synthesis, and all the metabolism of our body are controlled by this hormone. So we often see, and very frequently in my outpatient, I see patients who are having underfunctioning of this gland, which is not good for health, and also overfunctioning. Usually we recognize this by doing a simple test. We call it thyroid stimulating hormone. Mm-hmm. There is a normal level, and we also look for free T4. These two tests are important. Mm-hmm. If these values, if anybody does this test, if he feels, the symptoms are important for a person to know what is the underfunctioning of this gland or the overfunctioning. There are two entities, and rarely you get also. Like other diseases, cancer of thyroid is also seen. It's the second common cancer.
Yes. Yes.
Yeah.
So it's a really important topic, as you mentioned, doctor. And of course, lots of people don't know what are the symptoms of this kind of disease. So maybe you can tell them about the symptoms. How could they, know if they have, some symptoms of it, that this is kind of thyroid disease. Yes.
Thank you so much. The underfunctioning of this thyroid gland, commonly, people will complain of fatigue. They say that I'm feeling tired, muscular pains, and then fatigue. And they also have heat intolerance. Mm. They will feel shivering, and even they are sitting in normal temperature, they feel cold intolerance, we call it. Mm-hmm. And they feel shivering and this fatigue, and also they will lose hair, the skin becomes dry, and they are also constipated. They don't go to motion clearly, passing motion. These are the very common symptoms which these people, and they may overlook unless it reaches a stage when the person will feel difficulty to walk even, and the body he feels that is becoming body is swelling, is gaining weight, So these are the common symptoms which people have with underfunctioning of the thyroid gland.
Yes. So also when it comes into doctor managing this kind of disease, and once let's say we are diagnosed by this kind of disease, like what are the processes going to happen afterwards?
Exactly. You know, we usually, it's a very common problem, especially among the women. A thyroid problem, and we see that there is any swelling in the neck of the pertaining to the thyroid gland is called a goiter. We say it's called this hormone is made up of mainly iodine. Iodine is an important mineral. It is composed of this, and it is manufactured in this gland, and then it's secreted in the body for all our activity and this person's active thing and this. And I want to just mention also that it is very important for women also, in women, especially in pregnant women.
Yes.
Because if they are deficient, and they are found to be deficient, if they are known to have low functioning of thyroid gland, it is going to, if they don't take proper care of this and don't take proper treatment, it may affect the child. And the child, the embryogenesis, the first 3 months are very, very essential. And if it is an underfunctioning thyroid, then the child may become the nervous system, development of nervous system, and the fetal growth,
it
tissue,
could even be disabled.
Everything, disabled. It's called cretinism.
Yes.
The child is born with cretinism, which is mental retardation, and this is a very unfortunate thing. So we have to be alert for this condition, especially among the women who are pregnant. If they are known to have hypothyroidism, they have to be very closely monitored during the first 3 months, especially every month we have to do this test. TSH, a simple test, TSH, every month, and free T4. This we do, and in the second and third trimester, we can do it every 2 months, there is no problem.
So does it also affect pregnancy, like the chances of getting pregnant if you're affected with this kind of disease?
Yeah, usually, if it is underfunctioning, people sometimes abort also. So if a lady is not conceiving, one of the causes is also in a lower functioning of the thyroid gland.
So there are two types of disease:
the
lower and the higher functioning.
The lower functioning, we replace them with the hormone from outside. We give them 50 micrograms
to make it active,
to body to have it, so that the child is safe, mother is safe, and among all the people.
Yes. So the outcomes of having the low functioning of the thyroid itself makes the woman, let's say, gain more weight, feel tired all the time. But if it was really active, overactive, how does it work?
Yeah, the overactive will be X of this. The patient will have tremors, palpitations, sweating. He will say that we cannot tolerate heat. It is called heat intolerance, and they will lose weight also.
Yes.
This is also, and we see frequently also. We see this hyperfunctioning. It is called hyperfunctioning of the thyroid gland.
So also, does it affect the pregnant woman also? Like the child could be retarded, or no, when it's overactive?
No. This will not cause, but we have to treat them.
You have to treat them, but it will not cause, let's say, disabled
There are
child.
complications which can happen if you don't treat hyperfunctioning of the thyroid gland. Also, there will be complications like, unfortunately, we call it thyroid storm, and other things can happen. So we have to balance this and treat them. These two conditions are very, very important. And also I want to say about one entity, we call it autoimmune disease. It is called Hashimoto's thyroiditis, which finally leads to underfunctioning of the thyroid gland. So this is also becoming very common. Self-destruction, our body produces antibodies, and it causes the thyroid to get destroyed.
Yes.
So we have to replace it from outside. If you don't replace it, it is not good. And sometimes they are telling that in this Hashimoto's thyroiditis, or those people who receive for some reason radiation for anything, they get this goiter, and it can be in a very
like I've actually, let's say, seen some woman that actually, let's say, has something like swollen over here. Yes, and it moves, like sometimes when they talk, it's like something little bit.
Very simple thing, to protect such people. And I have in my career seen cases with, we call it papillary thyroid cancer. This is the second commonest cancer happening, in those people who are like had received radiation, or those people who have Hashimoto's thyroid disease. They are prone for this sort of disease. And it's a very, easy. People should not fear. Now there is no fear for any
Of
disease
course,
for
because
cancer.
of course
and
with
this.
the modern
Yeah.
itself, let's say
Yeah.
modern
And you know,
medicine and a modern, let's say, inventions that are, let's say, discovered for medicine itself.
Yes,
So
exactly.
it's not becoming dangerous. You
Yeah.
just go check it up and of course
we
treat
have
yourself.
a very good center in Mubarak Al-Kabir Hospital and in KCC, you know, where they do this, which is called fine needle aspiration cytology. It's a very simple test. It's not damaging to the patient. Very simple. They just go, and you have to explain to them, and the swelling in the neck, you know, and especially if it is solitary nodule. If you have a single nodule, and we call it cold nodule, you know, if it is there, they have to do the fine needle aspiration cytology, and that, you know, tells us a lot. It's a very simple procedure, but it will tell us the person is going to have this sort of papillary thyroid cancer. I had one patient, and she was having a painless swelling in her neck. They were my family friends. They just visited our house. I noticed what is this abnormal
you noticed
thing.
by coincidence. Yes.
And then I sent her immediately for FNAC.
Yes.
And you know, it turned out to be papillary thyroid cancer, and she got operated, and she's living up till now.
Oh,
25 years.
She's one of the lucky ones, let's say.
Yeah, you have to detect it immediately and get it operated, and that's it.
Yes.
So there's nothing to worry about.
So also when it comes into for women, or let's say people who are actually having this disease, could it happen because of them being so temper person and angry all the time, or it doesn't
no, it has nothing to do. But iodine deficiency in the world, and if you see the other parts of the world where there is iodine deficiency, these goiters are very common. And it's a very, very common problem, simple test to do, and we can sort it out. We always want to keep the level of the thyroid in the middle, you know, between 0.5 to 2.5 is the normal range. We want to keep this TSH always, so that the person remains active, healthy, you know. And for children also, especially when the mother is having hypothyroid, we are bothered about the baby also. We tell them to also screen the babies once they are born for this hypothyroidism. It's a very nasty disease, and it has very bad effects on the body.
Yes. So also when it comes into for people who are actually, let's say, getting affected by it or having this kind of disease within themselves, does it start with a really young age, or it starts when a woman is growing, or it varies from a case to case?
It can vary, you know, it can vary. But I have to tell you one thing, that among compared to men and women, 8 women suffer, and then compared to 1. 8 to 1 ratio. So women, it is more common. In my outpatient, I see every 4th, 5th patient is having thyroid deficiency.
So it's
very,
common
very common disease, and it's nothing to worry. You have to take one tablet of this L-toxin in the morning time without anything, and you remain happy and healthy. But if you leave it, it's going to make your life miserable. You are sleeping all the time, sleepiness, gaining weight, and you are really in it.
Yes, and of course you cannot tell a woman not to be scared, especially when it comes to these kind of cases, because it's really, let's say, in their nature themselves.
You know, they become all the hair loss.
Yes, you should, maybe they should, let's say, keep a picture of how you could be if you don't treat yourself, and then they will really get scared. So doctor, any last words you would like to give the audience, let's say advice maybe when it comes into that?
Yeah, actually I would, my advice is this: people should, you know, we don't normally screen people, but if you have symptoms, you should approach your doctor and get your TSH test done. I want to, if you have permit me to have some time, and I want to tell that also we see very frequently vitamin D deficiency. I can just a few words about vitamin D deficiency. It's a very, very common problem also, you know. And our skin is the main source of this vitamin D. Our vitamin D is an important thing for our bone metabolism, you know, our strength of our bone, how to prevent fractures of our bone, and vitamin D is so important. And milk is mother's milk, and other, you know, things are not the source. Vitamin D is except for the sun. Suppose if there is in some countries in Northern America and there is no sun for a few months. And dark people also complexion, they don't absorb vitamin D, so skin will not be helpful. So you have to supplement. The supplements are present in, you know, dairy products and in fish oils and in, you know, so that is important. Now also in governments, they fortify milk. In America, USA, they are fortifying the milk with, you know, because it is very important. Vitamin D is taking. That is why we supplement. There is no need to screen for vitamin D. Everybody should take vitamin D. At least 100 units has to go every day.
And then of course have to check it up when it comes into that part.
And if you are deficient, then you have to go higher values. You know, there are values, you know, for this.
Indeed.
We call it 25 hydroxyvitamin D.
Yes,
Yeah.
yes. Well, thank you very much, Doctor, for your time. It was really a pleasure. We had, let's say, lots
Thank
of
you so
great
much.
information out of you, and we'll inshallah have you in, let's say, different episodes to talk more about
Thank
cases
you so much,
itself.
Hiba,
Thank
for
you very
inviting
much.
me, and God bless you. Thank you so much.
Thank you. And with that, dear viewers, we're going to head to our report when it comes into the third Kuwait Corporate Social Responsibility Conference and Expo. So we'll enjoy watching it, and then we'll be back again.
Two days ago, there were a workshop about the corporate images, and it was held by Professor Dr. Hana Al-Junaid from Egypt. Today and tomorrow, there will be speakers from different parts of the world, mainly the Arab countries and the GCC. Today, Her Highness the Princess Lamia Al Saud from Al Walid bin Talal humanitarian aids and financial supports. She will speak about how the corporate can have an effect in promoting the social responsibilities and making a lot of inputs into sustainable development of the societies. Okay. Besides that, there will be other speakers from Saudi Arabia and from the Gulf states, from Egypt, all trying to involve the corporate social responsibilities in a sustainable way.